that influx of migrant workers is causing an increase in the prevalence rate of HIV/AIDS in Kitui, Makueni and Machakos. It seems, Professor, that inadvertently some of these large infrastructure projects are contributing to these rates. What have you observed in your county?
I think to some extent, and we are very, very pleased to, visit with you today.
Thank you.
We have had two major projects, actually three. There was this SGR, and then Thwake Dam, Multipurpose Dam, and Konza. Although Konza is still developing. And I really don't want to say that I am sure that it is that influx of migrant workers. But what I know is the population of 15, 24, 29, that's a very vulnerable population, because especially the new cases, what the information that we get from our medical people is over half of the new infections are in that particular age group. And we have seen from the behavior of those young people, now that they are not in school, it has really not been very good behavior. So I may not be able to say that it is really the people who have come to Makueni, or it is actually activity among particularly the young people, and of course older people, who may be taking advantage of those young people.
Okay, I think that's an important point you've raised there towards the end. Let me also ask you this. We've been informed that there have been very low antiretroviral uptake during this COVID-19 period. In your view, the bigger picture about how COVID-19 the war on COVID-19 has affected the war on HIV/AIDS, have you seen any changes in terms of the access to drugs in your county, for example?
One of the problems is people have not come to the health facilities as they did before. And initially it was because they thought that the health facilities were a source of infection of COVID-19. And therefore, they were not coming to the health facilities as much as they used to do before. And that meant that some who came to collect drugs may have missed to do that to a less extent. But we did notice a very clear drop in terms of people within Makueni of not coming for their supply of ARVs.
ARVs. Thank you so much, Prof, for that. Let me also bring in the other Professor Governor, Professor Anyang' Nyong'o, who joins us virtually. Prof, I don't know if you can hear me. I trust you can. Let me just...
I can hear you very well.
Fantastic. Let's get into it. Looking at the latest HIV estimates, Professor, Kisumu is second in HIV prevalence at 17.3%, just behind Homa Bay, which is at 18.5%. On this World AIDS Day, are you briefly able to tell Kenyans what interventions you've put in place to check that situation?
Actually, the latest report we had today was actually the prevalence is going down, by the way.
Okay.
And this is due to some very drastic intervention that have been taken over the years. First of all, those who have HIV positive, most of them are on ARVs. Yeah? And when you're on ARVs, the transmission is much less.
Okay.
And secondly, I think the public education by the public health workers and so on is paying some dividends.
And even as you give a very optimistic outlook, 17.3%, number two in Kenya, so to speak. I don't know if that's something that you are very concerned about. Is that something that you're looking to see change?
Well, of course we are.
Yes, go ahead, Prof.
Of course we are concerned, my brother. We are definitely concerned, and of course we would like it to be zero, by the way, but this is a historical thing. I really don't think it's 17.3 as they're saying. I think it's much lower than that, quite honestly. But I need to get the latest figure from our own public health officials but from what I saw in the press today, actually, there was something in the press which said that the prevalence of HIV in Kisumu is actually going down as COVID-19 is going up.
Okay.
But of course, quite often it depends on who is taking the statistics and the interpretation of the statistics. But the point is that nobody can be happy with prevalence of HIV or any percentage for that matter.
Okay, thank you so much, Professor, for that. I can see that's a